Welcome. In this renal system mastery session, you'll tackle 50 advanced NCLEX-style questions focused on acute kidney injury, AKI, and dialysis. These challenging clinical scenarios are designed to strengthen your critical thinking, improve prioritization skills, and prepare you for the complex renal questions commonly tested on the NCLEX. Have a notepad ready. Think through each scenario before viewing the answer, and use the rationales to deepen your understanding. Let's get started. Question 1. A 68-year-old man with a history of hypertension, type 2 diabetes mellitus, and chronic heart failure is admitted with septic shock secondary to pneumonia. Despite aggressive fluid resuscitation, broad-spectrum antibiotics, and vasopressor therapy, his urine output progressively decreases over the next 24 hours from 45 milliliters per hour to less than 10 milliliters per hour. Laboratory findings reveal serum creatinine rising from 1.1 milligrams per deciliter on admission to 3.6 milligrams per deciliter, BUN 78 milligrams per deciliter, potassium 6.5 milliequivalent/L, bicarbonate 14 milliequivalent/L, and arterial pH 7.19. Continuous ECG monitoring demonstrates peaked T waves. The nephrologist recommends immediate renal replacement therapy. Which assessment finding provides the strongest indication that dialysis should not be delayed? A. BUN of 78 milligrams per deciliter. B. Serum creatinine of 3.6 milligrams per deciliter. C. Hyperkalemia with ECG changes. D. Oliguria for 24 hours. Answer: C. Hyperkalemia with ECG changes. Rationale: refractory hyperkalemia causing ECG changes is a life-threatening emergency and is an absolute indication for emergent dialysis. Elevated creatinine, BUN, and oliguria alone do not necessarily require immediate dialysis unless accompanied by life-threatening complications. Question 2. A 55-year-old woman with AKI is scheduled for her first intermittent hemodialysis treatment. 30 minutes after dialysis begins, she suddenly complains of a severe headache, nausea, blurred vision, and increasing restlessness. Her blood pressure remains stable, and there is no evidence of blood loss. Which complication should the nurse suspect first? A. Disequilibrium syndrome. B. Air embolism. C. Hemolysis. D. Dialyzer hypersensitivity. Answer: A. Disequilibrium syndrome. Rationale: dialysis disequilibrium syndrome occurs during or shortly after initial dialysis sessions due to rapid removal of urea, leading to cerebral edema. Neurologic symptoms such as headache, nausea, confusion, seizures, and decreased consciousness are classic findings. Question 3. A patient receiving hemodialysis suddenly develops severe dyspnea, chest pain, coughing, and a sense of impending doom approximately 20 minutes into treatment. The nurse notices the venous tubing contains visible air bubbles. What is the priority nursing intervention? A. Stop dialysis immediately and clamp the bloodlines. B. Increase ultrafiltration. C. Place the patient in high Fowler's position. D. Flush the dialysis tubing with saline. Answer: A. Stop dialysis immediately and clamp the bloodlines. Rationale: an air embolism is a dialysis emergency. Dialysis must be stopped immediately to prevent additional air from entering the circulation. The patient should subsequently be positioned on the left side with the head lowered while emergency assistance is obtained. Question 4. A nurse is caring for a patient with oliguric AKI whose potassium level has increased from 5.3 milliequivalent/L to 6.8 milliequivalent/L despite medical management. Which physician order should the nurse anticipate if dialysis cannot begin immediately? A. Administer 4 regular insulin with dextrose. B. Restrict protein intake. C. Encourage oral potassium supplements. D. Increase maintenance for fluids. Answer: A. Administer 4 regular insulin with dextrose. Rationale: for insulin drives potassium into cells, temporarily lowering serum potassium while awaiting definitive treatment. Dextrose prevents hypoglycemia. This intervention does not remove potassium, but buys time until dialysis. Question 5. A patient undergoing chronic hemodialysis has an arteriovenous fistula in the left forearm. During morning assessment, the nurse cannot palpate a thrill or auscultate a bruit. Which nursing action is most appropriate? A. Notify the healthcare provider immediately. B. Apply warm compresses. C. Elevate the affected arm. D. Reassess after dialysis. Answer: A. Notify the healthcare provider immediately. Rationale: absence of both a thrill and bruit suggests fistula thrombosis or occlusion, which threatens vascular access and requires immediate evaluation. Question 6. A patient with severe AKI has gained 5 kilograms in the past 4 days despite strict fluid restriction. Bilateral crackles are heard halfway up both lung fields, and oxygen saturation has decreased to 88% on room air. Which finding represents the most urgent indication for dialysis? A. Rapid weight gain. B. Elevated BUN. C. Pulmonary edema. D. Mild hypertension. Answer: C. Pulmonary edema. Rationale: fluid overload causing pulmonary edema that is unresponsive to medical therapy is an absolute indication for dialysis because it threatens oxygenation and life. Question 7. A nurse caring for a patient immediately after hemodialysis notes the blood pressure has decreased from 156 to 88 mmHg before treatment to 92/54 mmHg afterward. The patient complains of dizziness and weakness. Which nursing intervention is the priority? A. Place the patient in the supine position. B. Encourage ambulation. C. Restrict oral fluids. D. Obtain another weight immediately. Answer: A. Place the patient in the supine position. Rationale: intradialytic hypotension commonly results from rapid fluid removal. The immediate priority is improving cerebral perfusion and preventing falls by placing the patient supine. Question 8. A patient with AKI has entered the diuretic phase after several days of oliguria. During this phase, which nursing assessment requires the greatest attention? A. Monitoring for dehydration and electrolyte losses. B. Monitoring for hyperkalemia. C. Monitoring for worsening pulmonary edema. D. Monitoring for increasing BUN only. Answer: A. Monitoring for dehydration and electrolyte losses. Rationale: during the diuretic phase, kidneys begin producing urine but cannot adequately concentrate it. Massive urine output can lead to dehydration, hypovolemia, hypokalemia, and hypotension. Question 9. The nurse is teaching a newly hired graduate nurse about laboratory trends in AKI. Which statement made by the graduate nurse indicates correct understanding? A. Creatinine usually rises before urine output decreases. B. Hyperkalemia is common because the kidneys cannot excrete potassium effectively. C. Metabolic alkalosis is expected. D. Patients usually develop hypophosphatemia. Answer: B. Hyperkalemia is common because the kidneys cannot excrete potassium effectively. Rationale: AKI commonly causes hyperkalemia, hyperphosphatemia, metabolic acidosis, and rising BUN/creatinine due to impaired renal excretion. Question 10. A critically ill patient develops AKI following extensive rhabdomyolysis after a motor vehicle collision. Despite aggressive treatment, urine output remains minimal, potassium continues rising, metabolic acidosis worsens, and pulmonary edema develops. Which nursing interpretation best explains why dialysis is now necessary? A. Dialysis is initiated because creatinine has exceeded a specific number. B. Dialysis replaces endocrine functions of the kidney. C. Dialysis is required because life-threatening complications of kidney failure are no longer controlled medically. D. Dialysis permanently restores kidney function. Answer: C. Dialysis is required because life-threatening complications of kidney failure are no longer controlled medically. Rationale: dialysis is initiated based on clinical indications such as refractory hyperkalemia, metabolic acidosis, pulmonary edema, toxin accumulation, or severe uremic symptoms, not on a specific creatinine level alone. Question 11. A 72-year-old man with long-standing hypertension and stage 3 chronic kidney disease is admitted after undergoing emergency repair of a ruptured abdominal aortic aneurysm. During the first postoperative day, his urine output decreases to 15 milliliters per hour despite adequate blood pressure and fluid resuscitation. His serum creatinine rises from 1.4 milligrams per deciliter preoperatively to 2.9 milligrams per deciliter, and his urine sodium is elevated. The nephrologist suspects intrinsic AKI caused by acute tubular necrosis, ATN. Which nursing assessment finding would most strongly support this diagnosis? A. Fractional excretion of sodium greater than 2%. B. Urine-specific gravity greater than 1.030. C. BUN to creatinine ratio greater than 20:1. D. Immediate improvement after 4 fluid administration. Answer. A. Fractional excretion of sodium greater than 2%. Rationale. In intrinsic AKI due to ATN, damaged renal tubules lose the ability to reabsorb sodium, resulting in increased urinary sodium excretion, FANA greater than 2%. Prerenal AKI usually presents with concentrated urine and low urinary sodium. Question 12. A patient receiving hemodialysis through a tunneled central venous catheter develops chills, fever of 39.4 degrees Celsius, 102.9 degrees Fahrenheit, and hypotension shortly after dialysis begins. Which nursing action has the highest priority? A. Stop dialysis, notify the provider, and obtain blood cultures as ordered. B. Continue dialysis while administering acetaminophen. C. Flush the catheter vigorously with normal saline. D. Remove the catheter dressing to inspect the insertion site only. Answer. A. Stop dialysis, notify the provider, and obtain blood cultures as ordered. Rationale. Fever and hypotension during dialysis raise concern for catheter-related bloodstream infection or sepsis. Dialysis should be stopped, cultures obtained, and prompt treatment initiated. Question 13. A patient undergoing maintenance hemodialysis asks why blood pressure measurements should never be taken on the arm containing the arteriovenous fistula. Which explanation by the nurse is most accurate? A. Compression may damage the fistula and reduce blood flow. B. Blood pressure readings are always inaccurate on that arm. C. It increases serum potassium levels. D. It causes dialysis disequilibrium syndrome. Answer. A. Compression may damage the fistula and reduce blood flow. Rationale. Blood pressure cuffs, venipunctures, and 4 insertions should be avoided on the fistula arm because compression can decrease blood flow and increase the risk of thrombosis. Question 14. A patient with severe AKI is receiving continuous renal replacement therapy, CRRT, in the intensive care unit. Which patient would benefit most from CRRT rather than intermittent hemodialysis? A. A hemodynamically unstable patient requiring high-dose vasopressors. B. A stable outpatient requiring routine dialysis. C. A patient with chronic kidney disease receiving home dialysis. D. A patient scheduled for kidney transplantation next month. Answer. A. A hemodynamically unstable patient requiring high-dose vasopressors. Rationale. CRRT removes fluid and solutes slowly over 24 hours, making it the preferred dialysis modality for critically ill, unstable patients who cannot tolerate rapid fluid shifts. Question 15. A nurse reviews laboratory values for a patient recovering from AKI. Which finding most strongly suggests that renal function is improving? A. Gradual decline in serum creatinine with increasing urine output. B. Persistent metabolic acidosis. C. Progressive hyperkalemia. D. Increasing BUN and decreasing urine output. Answer. A. Gradual decline in serum creatinine with increasing urine output. Rationale. Recovery from AKI is indicated by improving urine output and decreasing serum creatinine, reflecting restoration of glomerular filtration. Question 16. A patient receiving hemodialysis suddenly reports severe back pain, chest tightness, and shortness of breath approximately 15 minutes after treatment begins. The nurse notes dark reddish discoloration in the dialysis tubing. Which complication should the nurse suspect? A. Hemolysis. B. Hypoglycemia. C. Disequilibrium syndrome. D. Peritonitis. Answer. A. Hemolysis. Rationale. Hemolysis during dialysis presents with sudden back pain, chest pain, dyspnea, reddish blood in the tubing, and possible hyperkalemia. Dialysis should be stopped immediately. Question 17. A patient receiving peritoneal dialysis notices that today's drainage bag contains cloudy effluent accompanied by diffuse abdominal pain. Which nursing intervention should occur first? A. Notify the healthcare provider and send the dialysate for culture. B. Encourage increased oral fluid intake. C. Slow the dialysate infusion. D. Continue the exchange and reassess tomorrow. Answer: A. Notify the healthcare provider and send the dialysate for culture. Rationale: cloudy dialysate with abdominal pain strongly suggests peritonitis, the most serious complication of peritoneal dialysis. Prompt culture and antibiotic therapy are essential. Question 18. A patient with AKI has the following assessment findings. Potassium, 5.8 milliequivalent/L. BUN, 60 milligrams per deciliter. Respiratory rate, 24 per minute. Bilateral crackles at lung bases. Oxygen saturation, 90% on room air. Which assessment finding should the nurse report as the highest priority? A. Bilateral crackles with reduced oxygen saturation. B. Elevated BUN. C. Mild tachypnea. D. Potassium level of 5.8 milliequivalent/L. Answer: A. Bilateral crackles with reduced oxygen saturation. Rationale: although hyperkalemia requires close monitoring, impaired oxygenation from pulmonary edema threatens life immediately and requires urgent intervention. Question 19. The nurse is caring for a patient with AKI who is prescribed a renal diet. Which meal selection indicates the patient understands the dietary teaching? A. Grilled chicken, white rice, green beans, and apples. B. Ham sandwich with tomato soup and orange juice. C. Baked potato, spinach salad, banana, and milk. D. Peanut butter sandwich with yogurt and raisins. Answer: A. Grilled chicken, white rice, green beans, and apples. Rationale: patients with AKI often require restriction of potassium, phosphorus, sodium, and sometimes fluids. The other meal options contain several high potassium or high phosphorus foods. Question 20. A nurse is monitoring a patient immediately after completion of hemodialysis. Which assessment finding requires the most immediate follow-up? A. The patient reports mild fatigue. B. Blood pressure decreases from 148/84 mmHg to 84/48 mm of mercury with dizziness. C. The patient requests a meal. D. Temperature is 36.9 degrees Celsius, 98.4 degrees Fahrenheit. Answer: B. Blood pressure decreases from 148/84 mmHg to 84/48 mm of mercury with dizziness. Rationale: symptomatic hypotension is one of the most common and potentially dangerous complications following hemodialysis. Immediate interventions include placing the patient supine, assessing perfusion, and notifying the dialysis team if symptoms persist. Question 21. A 64-year-old woman with diabetes mellitus and chronic hypertension is admitted to the intensive care unit after developing septic shock from a urinary tract infection. During the first 48 hours, her urine output declines to less than 0.3 milliliters per kilogram per hour despite adequate fluid resuscitation and stabilization of her blood pressure. Laboratory studies reveal a serum creatinine of 4.2 milligrams per deciliter, BUN of 92 milligrams per deciliter, potassium of 6.1 milliequivalent/L, bicarbonate of 16 milliequivalent/L, and phosphorus of 6.8 milligrams per deciliter. The nephrologist discusses initiating dialysis. Which assessment finding would provide the strongest evidence that conservative medical management has failed? A. Persistent hyperkalemia despite medical therapy. B. Elevated serum creatinine. C. Hyperphosphatemia. D. Oliguria lasting 48 hours. Answer: A. Persistent hyperkalemia despite medical therapy. Rationale: refractory hyperkalemia despite interventions such as insulin, dextrose, calcium, bicarbonate, or potassium binders is an absolute indication for dialysis because it places the patient at immediate risk for fatal cardiac dysrhythmias. Question 22. A patient receiving hemodialysis reports sudden itching, chest tightness, wheezing, facial flushing, and difficulty breathing within the first 5 minutes of treatment. Which complication should the nurse suspect first? A. Dialyzer hypersensitivity reaction. B. Dialysis disequilibrium syndrome. C. Air embolism. D. Hypoglycemia. Answer: A. Dialyzer hypersensitivity reaction. Rationale: Allergic reactions to the dialyzer membrane or sterilizing agents typically occur within the first few minutes of dialysis and present with wheezing, dyspnea, flushing, urticaria, and chest tightness. Dialysis should be stopped immediately. Question 23. A nurse is caring for a patient with an arteriovenous graft used for chronic hemodialysis. Which assessment finding requires immediate intervention? A. The graft site is warm, erythematous, swollen, and draining purulent fluid. B. A palpable thrill is present. C. A continuous brood is heard. D. Mild bruising from the previous dialysis session. Answer. A. The graft site is warm, erythematous, swollen, and draining purulent fluid. Rationale. These findings strongly suggest infection of the vascular access. Prompt treatment is essential because vascular access infections can rapidly progress to bacteremia or sepsis. Question 24. A patient with AKI enters the recovery phase after several weeks of treatment. During morning assessment, the nurse notes a urine output of 6 liters over the previous 24 hours. Which physician order should the nurse question? A. Strict intake and output monitoring. B. Daily electrolyte measurements. C. Restrict all oral fluids to 500 milliliters per day. D. Daily weight. Answer. C. Restrict all oral fluids to 500 milliliters per day. Rationale. During the diuretic phase, patients are at high risk for dehydration due to excessive urine losses. Severe fluid restriction could worsen hypovolemia and hypotension. Question 25. A nurse is evaluating a patient immediately before hemodialysis. Which assessment is most important to obtain before treatment begins? A. Accurate body weight. B. Visual acuity. C. Pupillary response. D. Glasgow Coma Scale. Answer. A. Accurate body weight. Rationale. Pre-dialysis weight determines the amount of fluid to be removed during treatment. Accurate weight is critical for preventing both fluid overload and excessive ultrafiltration. Question 26. A patient receiving continuous renal replacement therapy, CRRT, suddenly develops bleeding from the central venous catheter insertion site. Laboratory results reveal a prolonged activated partial thromboplastin time, APTT. Which is the nurse's priority action? A. Notify the healthcare provider and assess for anticoagulant-related bleeding. B. Increase the CRRT flow rate. C. Flush the catheter with heparin. D. Remove the dialysis catheter immediately. Answer. A. Notify the healthcare provider and assess for anticoagulant-related bleeding. Rationale. Anticoagulation is commonly used during CRRT to prevent circuit clotting. Prolonged APTT with active bleeding requires prompt evaluation and possible adjustment or reversal of anticoagulation. Question 27. A patient with severe AKI has the following laboratory results. Potassium, 6.7 milliequivalent/L. Calcium, 8.8 milligrams per deciliter. Magnesium, 2.1 milligrams per deciliter. Sodium, 136 milliequivalent/L. Which electrocardiographic finding would the nurse expect first? A. Tall, peak T waves. B. ST segment elevation. C. Atrial flutter. D. Prolonged QT interval. Answer. A. Tall, peak T waves. Rationale. Peak T waves are one of the earliest ECG manifestations of hyperkalemia. As potassium rises further, widening of the QRS complex, loss of P waves, ventricular dysrhythmias, and cardiac arrest may occur. Question 28. A patient undergoing peritoneal dialysis complains that dialysate infusion causes significant shoulder pain. Which explanation by the nurse is most appropriate? A. The solution may be irritating your diaphragm, causing referred shoulder pain. B. This means the catheter has become infected. C. Your potassium level is probably too high. D. This indicates the dialysis solution is contaminated. Answer. A. The solution may be irritating your diaphragm, causing referred shoulder pain. Rationale. Referred shoulder pain during dialysate infusion commonly results from diaphragmatic irritation caused by the dialysis solution and is not necessarily a sign of infection. Question 29. A patient receiving chronic hemodialysis asks why sodium and fluid intake must be restricted between treatments. Which response by the nurse is most accurate? A. Too much sodium and fluid can lead to fluid overload, hypertension, and pulmonary edema. B. Fluid restriction prevents anemia. C. Extra sodium improves dialysis efficiency. D. Fluid restriction prevents metabolic acidosis. Answer: A. Too much sodium and fluid can lead to fluid overload, hypertension, and pulmonary edema. Rationale: excess sodium increases thirst and promotes water retention. Excessive fluid gain between dialysis sessions increases the risk of hypertension, heart failure, and pulmonary edema, while making fluid removal during dialysis more difficult. Question 30. A nurse is caring for 4 patients with AKI. Which patient should the nurse assess first? A. A patient with a potassium level of 7.0 milliequivalent/L who has developed a wide QRS complex. B. A patient with a BUN of 82 milligrams per deciliter who reports mild fatigue. C. A patient with generalized edema and blood pressure of 148/86 mmHg. D. A patient whose urine output has decreased from 45 milliliters per hour to 30 milliliters per hour over the last 4 hours. Answer: A. A patient with a potassium level of 7.0 milliequivalent/L who has developed a wide QRS complex. Rationale: severe hyperkalemia with ECG changes is an immediate life-threatening emergency due to the risk of ventricular dysrhythmias and cardiac arrest. This patient requires urgent intervention, including stabilization and likely emergent dialysis. Question 31. A 70-year-old man with acute kidney injury secondary to prolonged hypotension has been receiving intermittent hemodialysis for 1 week. 30 minutes before the end of today's treatment, he becomes restless and reports painful muscle cramps in both legs. His blood pressure decreases from 148/82 mmHg to 90/56 mmHg. His heart rate increases to 118 beats/minute, and he appears pale and diaphoretic. Which nursing intervention should be implemented first? A. Decrease or stop ultrafiltration, place the patient supine, and notify the dialysis team. B. Encourage the patient to ambulate to improve circulation. C. Administer a potassium supplement immediately. D. Raise the head of the bed to high Fowler's position. Answer: A. Decrease or stop ultrafiltration, place the patient supine, and notify the dialysis team. Rationale: rapid fluid removal can cause intradialytic hypotension and painful muscle cramps. The priority is to improve perfusion by reducing ultrafiltration, positioning the patient supine, and notifying the dialysis team for further management. Question 32. A patient with AKI develops progressive confusion, difficulty concentrating, nausea, persistent vomiting, and a pericardial friction rub. Laboratory findings include BUN 128 milligrams per deciliter and serum creatinine 8.1 milligrams per deciliter. Which complication is the nurse most concerned about? A. Symptomatic uremia requiring urgent dialysis. B. Hyperglycemia. C. Hypocalcemia. D. Nephrotic syndrome. Answer: A. Symptomatic uremia requiring urgent dialysis. Rationale: uremic manifestations such as encephalopathy, persistent nausea and vomiting, and uremic pericarditis are indications for urgent dialysis because toxin accumulation is producing life-threatening complications. Question 33. A patient is recovering from AKI after severe dehydration caused by gastroenteritis. Which laboratory trend best indicates that renal function is improving? A. Serum creatinine decreases from 5.2 milligrams per deciliter to 2.1 milligrams per deciliter over several days. B. Potassium increases from 5.1 to 6.2 milliequivalent/L. C. BUN increases steadily each day. D. Urine output falls from 60 milliliters per hour to 10 milliliters per hour. Answer: A. Serum creatinine decreases from 5.2 milligrams per deciliter to 2.1 milligrams per deciliter over several days. Rationale: a downward trend in serum creatinine accompanied by improving urine output is one of the best indicators that kidney function is recovering. Question 34. A nurse is caring for a patient receiving peritoneal dialysis. During the drainage phase, only a small amount of dialysate returns despite repositioning the patient. Which nursing action should be taken next? A. Check the tubing for kinks or obstruction and ensure the drainage bag is below the abdomen. B. Forcefully irrigate the catheter with sterile water. C. Remove the peritoneal dialysis catheter. D. Increase the infusion pressure of the next exchange. Answer: A. Check the tubing for kinks or obstruction and ensure the drainage bag is below the abdomen. Rationale: poor dialysate outflow is commonly caused by mechanical problems such as tubing obstruction, kinks, constipation, or improper positioning. These should be assessed before considering more invasive interventions. Question 35. A patient with an arteriovenous fistula asks how to protect the access site at home. Which statement indicates the need for further teaching? A. I'll check every day to feel for the thrill. B. I'll avoid carrying heavy objects on that arm. C. I'll let blood pressure be taken from that arm if my other arm is sore. D. I'll report redness or swelling immediately. Answer: C. I'll let blood pressure be taken from that arm if my other arm is sore. Rationale: blood pressure measurements, venipunctures for insertions, and constrictive clothing should never be used on the fistula arm because they can compromise blood flow and damage the access. Question 36. A patient with severe AKI is prescribed sodium polystyrene sulfonate, Kxalate, while awaiting dialysis. The nurse understands that this medication primarily works by A. Exchanging sodium for potassium in the gastrointestinal tract. B. Driving potassium into the cells. C. Increasing renal potassium excretion. D. Neutralizing metabolic acidosis. Answer: A. Exchanging sodium for potassium in the gastrointestinal tract. Rationale: sodium polystyrene sulfonate removes potassium through the intestines. Unlike insulin with dextrose, it does not rapidly shift potassium into cells and is not appropriate as sole therapy for life-threatening hyperkalemia. Question 37. A patient receiving hemodialysis suddenly develops severe chest pain, hypotension, tachycardia, and distended neck veins. Which complication should the nurse suspect? A. Cardiac tamponade. B. Hypoglycemia. C. Constipation. D. Dialysis disequilibrium syndrome. Answer: A. Cardiac tamponade. Rationale: patients with advanced kidney failure may develop uremic pericarditis that can progress to cardiac tamponade. Beck's triad, hypotension, jugular venous distension, muffled heart sounds, requires immediate emergency intervention. Question 38. A nurse is assessing 4 patients undergoing dialysis. Which patient should be evaluated first? A. A patient whose venous needle has become dislodged with active bleeding from the fistula. B. A patient complaining of mild fatigue after treatment. C. A patient reporting hunger during dialysis. D. A patient with a blood pressure of 142/84 mmHg before treatment. Answer: A. A patient whose venous needle has become dislodged with active bleeding from the fistula. Rationale: needle dislodgement can result in rapid, life-threatening blood loss. Immediate pressure should be applied, dialysis stopped, and emergency assistance obtained. Question 39. A patient with oliguric AKI is prescribed a fluid allowance of yesterday's urine output plus 600 milliliters. Yesterday's urine output totaled 450 milliliters. What is the patient's maximum fluid allowance for today? A. 750 milliliters. B. 900 milliliters. C. 1,050 milliliters. D. 1,250 milliliters. Answer: C. 1,050 milliliters. Rationale: daily fluid allowance is often calculated as the previous 24-hour urine output plus approximately 600 milliliters to replace insensible losses. Calculation: 450 milliliters plus 600 milliliters equals 1,050 milliliters. Question 40. A patient with severe AKI has the following assessment findings. Potassium, 6.9 milliequivalent/L. Arterial pH, 7.14. Pulmonary edema despite 4 diuretics. Increasing confusion and lethargy. BUN, 112 milligrams per deciliter. Which nursing interpretation is most accurate? A. The patient has multiple absolute indications for emergent dialysis. B. Continue conservative therapy because creatinine determines dialysis timing. C. Restrict protein intake only. D. Dialysis should be delayed until urine output stops completely. Answer: A. The patient has multiple absolute indications for emergent dialysis. Rationale: this patient demonstrates several classic AIOU indications for dialysis. Acidosis, severe metabolic acidosis. Electrolyte imbalance, refractory hyperkalemia. Overload, pulmonary edema unresponsive to treatment. Uremia, altered mental status with markedly elevated BUN. The presence of multiple life-threatening complications makes emergent dialysis the appropriate intervention. Question 41. A 67-year-old patient with severe AKI secondary to septic shock is receiving continuous renal replacement therapy, CRRT. During the morning assessment, the nurse notes the filter pressures have progressively increased over the past hour. The blood flow rate has decreased, and multiple clot alarms are sounding. The patient remains hemodynamically stable. Which nursing action is the priority? A. Assess the CRRT circuit for clotting and notify the dialysis team immediately. B. Increase the blood pump speed without further assessment. C. Silence the alarms and continue therapy. D. Disconnect the patient from the CRRT machine without assistance. Answer: A. Assess the CRRT circuit for clotting and notify the dialysis team immediately. Rationale: rising filter pressures and repeated clot alarms strongly suggest clot formation within the CRRT circuit. Early intervention prevents complete circuit failure, blood loss, and interruption of renal replacement therapy. Question 42. A patient with AKI has not required dialysis for the past 4 days. Which assessment finding best indicates recovery of renal function? A. Serum creatinine has steadily declined. Urine output has normalized, and electrolyte levels remain stable. B. BUN remains elevated, and urine output is less than 200 milliliters per day. C. Potassium remains 6.3 milliequivalent/L despite treatment. D. Pulmonary edema has worsened despite diuretics. Answer: A. Serum creatinine has steadily declined. Urine output has normalized, and electrolyte levels remain stable. Rationale: recovery from AKI is reflected by improving glomerular filtration, increasing urine output, decreasing serum creatinine, and stabilization of electrolyte balance. Question 43. A nurse is preparing to administer medications to a patient scheduled for hemodialysis in 1 hour. Which prescribed medication should the nurse question before dialysis? A. Lisinopril, ACE inhibitor. B. Water-soluble vitamin supplement after dialysis. C. Epoetin alpha as prescribed. D. Renal multivitamin after treatment. Answer: A. Lisinopril, ACE inhibitor. Rationale: antihypertensive medications are often withheld before hemodialysis because they may contribute to significant intradialytic hypotension. The nurse should clarify the order based on facility protocol and the patient's blood pressure. Question 44. A patient receiving peritoneal dialysis suddenly develops fever, diffuse abdominal tenderness, rebound tenderness, and cloudy dialysate. Which complication is the nurse's highest priority concern? A. Peritonitis. B. Constipation. C. Catheter migration. D. Hyperglycemia. Answer: A. Peritonitis. Rationale: fever, abdominal pain, rebound tenderness, and cloudy dialysate are classic findings of peritonitis. This complication requires immediate cultures and prompt antibiotic therapy to prevent sepsis. Question 45. A nurse is teaching a newly diagnosed dialysis patient about foods that should be limited because of their high potassium content. Which food selected by the patient indicates a need for further teaching? A. Banana. B. Apple. C. White rice. D. Green beans. Answer: A. Banana. Rationale: bananas are rich in potassium and should generally be limited by patients receiving dialysis. Apples, white rice, and green beans are relatively lower potassium choices. Question 46. A patient undergoing hemodialysis suddenly complains of severe shortness of breath, chest pain, cyanosis, and anxiety. The nurse suspects an air embolism. After stopping dialysis, which position should the nurse place the patient in? A. Left lateral Trendelenburg position. B. High Fowler's position. C. Supine with legs elevated. D. Right lateral position. Answer: A. Left lateral Trendelenburg position. Rationale: Placing the patient in the left lateral Trendelenburg position helps trap air within the right atrium and ventricle, reducing the amount of air entering the pulmonary circulation while emergency treatment is initiated. Question 47. A patient recovering from AKI is producing 4,500 milliliters of urine daily. Which nursing intervention is most appropriate during this phase? A. Closely monitor for hypovolemia, hypotension, and electrolyte depletion. B. Restrict all fluids regardless of assessment findings. C. Encourage foods high in potassium without monitoring laboratory values. D. Anticipate worsening pulmonary edema. Answer. A. Closely monitor for hypovolemia, hypotension, and electrolyte depletion. Rationale. During the diuretic phase of AKI, large urine losses increase the risk of dehydration, hypotension, hyponatremia, and hypokalemia. Careful monitoring and replacement are essential. Question 48. A nurse is caring for 4 patients receiving renal replacement therapy. Which patient should be seen first? A. A patient whose fistula has no palpable thrill or audible bruit. B. A patient requesting a blanket during dialysis. C. A patient reporting mild fatigue after treatment. D. A patient asking when lunch will be served. Answer. A. A patient whose fistula has no palpable thrill or audible bruit. Rationale. The absence of both a thrill and bruit suggests thrombosis or occlusion of the vascular access, threatening the patient's lifeline for dialysis. Immediate assessment and intervention are required. Question 49. A nurse is evaluating a patient with severe AKI. Which laboratory trend should be reported immediately? A. Potassium increasing from 5.8 to 6.9 milliequivalent/L with new ECG abnormalities. B. Creatinine decreasing from 4.8 to 4.2 milligrams per deciliter. C. Hemoglobin increasing from 9.1 to 9.5 g/dl. D. Sodium increasing from 134 to 136 milliequivalent/L. Answer. A. Potassium increasing from 5.8 to 6.9 milliequivalent/L with new ECG abnormalities. Rationale. Severe hyperkalemia with ECG changes is a medical emergency because it can rapidly progress to fatal ventricular dysrhythmias and cardiac arrest. Immediate intervention and likely emergent dialysis are required. Question 50. A nurse is caring for a patient with AKI who suddenly develops refractory pulmonary edema, severe metabolic acidosis, pH 7.12, potassium of 7.1 milliequivalent/L despite insulin and dextrose therapy, increasing confusion, and uremic pericarditis. The nephrologist orders emergent hemodialysis. Which statement by the nurse best explains the rationale for this intervention? A. Dialysis is being started because your creatinine has reached a specific level. B. Dialysis is necessary because your kidneys can no longer maintain life-sustaining fluid, electrolyte, and waste balance despite medical treatment. C. Dialysis will permanently cure your kidney injury. D. Dialysis is being performed only to improve your urine output. Answer. B. Dialysis is necessary because your kidneys can no longer maintain life-sustaining fluid, electrolyte, and waste balance despite medical treatment. Rationale. Dialysis is indicated when life-threatening complications, such as refractory hyperkalemia, severe metabolic acidosis, fluid overload causing pulmonary edema, and symptomatic uremia, cannot be controlled medically. It supports the body's essential functions while allowing time for renal recovery when possible. Excellent work completing all 50 questions. Renal emergencies require rapid assessment and sound clinical judgment, and mastering topics like AKI, dialysis indications, electrolyte imbalances, vascular access care, and dialysis complications will give you a significant advantage on the NCLEX. Review any questions you found challenging, revisit the rationales, and continue practicing consistently. Every question you master brings you one step closer to becoming a safe, confident, and successful nurse. Best of luck with your studies.